The ATI Nutrition for Nursing module provides essential knowledge on nutrition and its role in health promotion, disease prevention, and patient care. It covers macronutrients such as carbohydrates, proteins, and fats, micronutrients like vitamins and minerals, hydration, and specialized diets for various medical conditions. Key topics include basic nutritional concepts, understanding energy balance, metabolism, and dietary guidelines. Lifespan nutrition, which addresses nutritional needs from infancy to older adulthood, including pregnancy and lactation. Medical nutrition therapy, focusing on diet modifications for conditions like diabetes, cardiovascular disease, gastrointestinal disorders, renal disease, and malnutrition. Enteral and parenteral nutrition, covering indications, administration, and complications of tube feedings and IV nutrition. And cultural and ethical considerations, which include dietary preferences, religious restrictions, and patient-centered nutrition education. This module helps nursing students apply evidence-based nutrition principles in patient care, promoting optimal health outcomes. ATI Nutrition Practice Test, 10 questions. 1. A nurse is educating a client with hypertension on the dash, dietary approaches to stop hypertension diet. Which of the following recommendations should the nurse include? A. Increase intake of processed meats. B. Limit sodium intake to 2,300 milligrams per day. C. Consume high-fat dairy products. D. Reduce intake of whole grains. The correct answer is B. Limit sodium intake to 2,300 milligrams per day. Explanation. The DASH diet focuses on reducing sodium intake, increasing fruits, vegetables, and whole grains, and consuming low-fat dairy products to help lower blood pressure. Processed meats are high in sodium and high-fat dairy is discouraged. 2. A client with iron deficiency anemia asks the nurse which foods are good sources of iron. The nurse should recommend which of the following? A. Milk and dairy products. B. Chicken and leafy green vegetables. C. White rice and bananas. D. Whole grain bread and apples. The correct answer is B. Chicken and leafy green vegetables. Explanation. Iron-rich foods include lean meats, such as chicken and beef, leafy greens like spinach and kale, and legumes. Dairy products can inhibit iron absorption. 3. A nurse is caring for a client with celiac disease. Which of the following foods should the nurse instruct the client to avoid? A. Rice and corn. B. Wheat and barley. C. Fresh fruits and vegetables. D. Dairy products. The correct answer is B. Wheat and barley. Explanation. Clients with celiac disease must follow a strict gluten-free diet, avoiding wheat, barley, and rye. Rice and corn are safe alternatives. Alright, let's move on to question 4. A nurse is teaching a client about complete and incomplete proteins. Which of the following foods is a complete protein? Is it beans, peanut butter, eggs, or whole wheat bread? The correct answer is eggs. Complete proteins contain all 9 essential amino acids and are found in animal products like eggs, meat, poultry, and dairy. Plant-based proteins, such as beans, are typically incomplete, except for soy and quinoa. Now, question 5. A nurse is caring for a client who follows a vegan diet. The nurse should recognize that the client may be at risk for which of the following nutritional deficiencies? Is it vitamin C, vitamin B12, fiber, or potassium? The correct answer is vitamin B12. Vitamin B12 is primarily found in animal products, making vegans at risk for deficiency. They may need fortified foods or supplements. Moving on to question 6. A nurse is providing dietary education to a client with osteoporosis. Which of the following foods should the nurse recommend to promote bone health? Should it be salmon and broccoli, apples and carrots, white bread and pasta, or coffee and tea? The correct answer is salmon and broccoli. Foods rich in calcium and vitamin D, such as dairy, leafy greens, and fatty fish like salmon, help strengthen bones. Caffeine can interfere with calcium absorption. A nurse is teaching a client with chronic kidney disease about dietary modifications. Which of the following recommendations should the nurse include? A. Increase potassium-rich foods. B. Consume high-protein meals. C. Limit phosphorus intake. D. Drink at least 4 liters of water daily. Correct answer: limit phosphorus intake. Clients with kidney disease should limit phosphorus intake to prevent bone and heart complications. High-protein diets may be restricted depending on the stage of kidney disease. A nurse is providing education about healthy fats. Which of the following is an example of a heart-healthy fat? A. Butter. B. Coconut oil. C. Olive oil. D. Lard. Correct answer, olive oil. Olive oil is a monounsaturated fat, which is beneficial for heart health. Saturated fats like butter and lard can increase the risk of cardiovascular disease. A nurse is educating a postpartum client about increasing lactation. Which of the following foods should the nurse recommend to promote milk production? A. White rice and crackers. B. Oatmeal and almonds. C. Fried chicken and French fries. D. Ice cream and soda. Correct answer, oatmeal and almonds. Foods like oatmeal, almonds, and flax seeds are known to support lactation. Hydration is also essential for milk production. A nurse is caring for a client with diabetes mellitus. Which of the following dietary recommendations should the nurse provide? A. Avoid all carbohydrates. B. Consume low glycemic index foods. C. Eat large meals to maintain blood sugar levels. D. Increase intake of saturated fats. Correct answer, consume low glycemic index foods. Low glycemic index foods such as whole grains, legumes, and non-starchy vegetables help maintain stable blood sugar levels. Carbohydrates are necessary but should be chosen wisely. Thanks for watching. Good luck on your nursing journey.